Welcome to Living Well. We're so happy that you joined us again today to hear about how we can care for our mind, our body, and our spirit. Today, we have a very important topic that many people really don't like talking about, but it is Alzheimer's disease. And more than just talking about the disease, we want to talk about caregivers' role in providing support and seeking out resources for individuals with Alzheimer's. I do want to let you know that this presentation is for educational purposes only. We do not assess, diagnose, treat any conditions whatsoever. You're going to hear some really interesting information, but if you have any questions specific to what's going on with you, we're going to ask that you seek out the professional help of your provider or your physician. Again, today our topic is about Alzheimer's disease and the caregiver's role. And our presenter is Connie Brown. Connie, Emily and I are so happy, very happy that you have studied this topic and that you will be presenting it to our Living Well audience today. Welcome, Connie. I will turn it over to you.
All right. Thank you very much. Good afternoon, everyone. I would really, instead of going into my whole bio, just give you briefly about who I am, but spend the time on the topic because I have a lot of information that I want to cover and I want to make sure I get through it. Again, thank you for inviting me to come speak on this topic. My name is Constance Brown. I go by Connie. I'm a registered nurse of greater than 40 years. My background is critical care, neuro, ICU, PCU, CCU, anything cardiac and neuro is basically what I did. I was a traveling nurse in the days when nobody knew about it in the 80s. Different world. Currently, I have been case manager as high as director of case management of hospitals. So I know what we see with families taking care of their loved ones with this condition, discharge planning. I am a health minister through Bethel Baptist Association of Florida, where I oversee 14 churches through multiple counties. I'm a member of Central Florida Black Nurses Association of Orlando. I'm also have been a past board member of the National Black Nurse Association, and I'm newly chartered member of New Eta Eta Chi Eta Phi sorority, which is a nursing sorority. But all of that said is everything that I do and about is my passion and love for the community and how we can help each other to live a better life, learn about conditions and what we can do to stay well. I'm going to go ahead and move forward with my presentation. It's more than 30 minutes because they know how I like to talk, but I'm going to try and shorten it where I can and lengthen it where I can see it may be information you need. So Alzheimer's disease and caregiving issues, what you need to know. Now, for me, when I looked at that topic, and I've spoke on this before, I think my subtopic would be it's a family affair because everyone in the family becomes involved when a loved one has this condition. If you didn't know, this is not Alzheimer's disease month, but November is Alzheimer's Awareness Month. So in November, make sure you wear your purple ribbon or wear your purple in honor or memory of a loved one. Trying to get it to advance. Well, when we tried it out, it moved forward. There we go. All right. So what is the topic of conversation today? Oh my goodness, you look at this and I have all this information that I want to talk about, but I'm going to slowly break it down bit by bit. And as she say at the end, you can ask questions if you have some. Everyone has a story. So testimony is the first thing I want to talk about. I don't have Alzheimer's, but I know friends and family members who have had Alzheimer's and have taken care of a loved one. And you yourself on this call today may have been on this journey. Next, we're going to talk about Alzheimer's versus dementia. Are they the same or what is the difference? Because people use those terms interchangeably, but are they the same thing? Risk factors. Okay, risk factors, you will find the risk factors for Alzheimer's disease are about the same risk factors for every health condition, heart disease, diabetes, cancer. So when we learn about modifiable risk factors, those things that you can change, we'll briefly talk about that. Things like dietary, moving, not so much exercise, and then non-modifiable conditions like genetics. And we will mention genetics as we talk about Alzheimer's. Next, we'll talk about the 3 stages of Alzheimer's. There are really 7 stages, but time will not allow me to go through all 7. So we're just going to hit the highlights of mild, moderate, and severe. Diagnosis, we'll mention a little bit, and treatment options, as you heard her say the waiver earlier. I'm not going to focus on treatment because I really feel like that's something you should work with your provider on, but we will mention some. And then last, caregiving issues. Caregiving is dear to my heart. One thing I didn't mention is I'm executive director of United Community Outreach. We've been dealing with caregiving issues ever since 1997, when no one else was talking about how should caregivers take care of their loved ones. Now, I'm going to start out today with a testimonial. And you see the name, Mrs. Mary P. Jackson. And those nurses that are on here, you know, we like to do case studies. So this will be a little case study for everyone that I want you to listen to what I'm saying about this testimonial. So who is Mary Jackson? Mary Jackson was my best friend. She traveled with me for 4 years as a traveling nurse. We went to nursing school, we were roommates, we did everything together, but we were besties, as you would call it, and we talked all the time. Well, in 2020, Mary succumbed to Alzheimer's disease and passed away during COVID, not from COVID, but complications of Alzheimer's disease. But what I remember about my friend Mary Jackson is why I want to talk about it. And you may be able to relate to some of the signs and symptoms of what we saw her going through. Mary was pretty predictable. You know, you have those friends that you know what they're going to do and you know they're going to stick to it. Well, Mary and I talked every day on the phone, and one day she called to say she quit her job as a nurse in critical care. She quit her job. Why did she quit her job? No one knew until later, till she got really sick, that she was getting hostile at work with the patients, hostile with the doctors, and hostile with the staff. This is a quiet, humble young lady, a behavior change that no one picked up on. And even the hospital didn't say, well, Mary, what's going on? Is this something we can do? Moving forward, Mary was a wife, a mother, a loving friend. She was going back to school to get her master's to be an instructor because she wanted to teach young nurses about getting into the field. But as I mentioned, she just quit her job. She didn't quit her job, she was forced out of her job. As time went on, I went to visit Mary in Atlanta. And the last time I went to visit her, she didn't know who I was. She didn't know who my husband was. And she was walking into a wall, walking, bumping a wall. This sounds dramatic. It was traumatic to me. So I know what some of you go through taking care of your loved ones, to see someone you know going through all these changes. Well, listen to this. Her mother had Alzheimer's in her 80s. Mary was diagnosed in her 50s. 50s. Very unusual. So sometimes Alzheimer's can start 10, 15, 20 years before they ever diagnose you. You're having signs and symptoms. And in the end, with Mary, and I told you she did succumb to her diagnosis, she was bedridden, couldn't speak, couldn't walk, couldn't talk. But in the end, she had been in a nursing home. A good friend took her out, took her home, and she cared for her, and she died in a loving environment with her friend and her husband being at the bedside. That is the goal that we do with our families. We want to make sure that we're there for them. But I want you to think about the symptoms that I mentioned about Mary. You know, she would walk out of the house and never find her way back. She would go to the library and the neighbors would bring her home. She took her husband to work and never went back to pick him up. Now, when you see things like that, you know it's out of the ordinary. But she wasn't here with me. I just knew something was wrong. So for you, I say moving forward, I call it a family affair because everything that went on with Mary impacted her husband, her children, her friends, her church family, and, just everybody. So think about Alzheimer's disease being a family affair because it impacts everyone that you're around in some kind of way in different ways. What I'd like to talk about is statistics next. Nobody likes to talk about numbers, but if I asked everyone to raise their hand right now that knew somebody that has high blood pressure, hypertension, 80 to 90% would raise your hand that either you have it or you know someone have it or you've taken care of someone that have it. So what does that have to do with Alzheimer's disease? As I move along, I'm going to tell you that's one of the risk factors. So when you look at the stats, and I broke it out from research that I found, that African Americans are about twice as likely to have Alzheimer's or other dementias than Caucasian. Hispanic and Latino community, they have language barriers that may limit their access to healthcare and often the delay in diagnosis and treatment because maybe that provider can't communicate with them and they're trying to tell what's going on, what changed. You heard me talk about Mary, and I'm going to refer back to Mary throughout this presentation that something's wrong with your family and friends, but you don't know what. But when you go to the doctor and provider, you've got to be able to share what you see and what's different. Caucasian, you see, it says better access to early diagnosis and treatment resources. Now, I'm not going to get into the inequities that we see in healthcare, but there are biases and inequities in healthcare. We see what goes on in our nation every day. It impacts our healthcare the same way. But I wanted to mention these stats because it's very important when you talk about African Americans and minorities have the highest rate of chronic conditions. You will see later on these chronic conditions are related to Alzheimer's disease. Information I found also was Alzheimer's is the most expensive diagnosis in the United States, not cancer, not heart disease, but Alzheimer's. Because when you think about the care that's provided, how long it takes them to diagnose and find out what's going on, it's a significant impact to Medicare because you're seeing it in older adults. It's an impact to Medicaid, the individual, the caregiver, and the family. Now we're going to move on and get into why we're here. Some people call it brain health. So Alzheimer's versus dementia. And you thought when I said that, what in the world does she mean that they're not the same? If you see on this slide, dementia is an umbrella term used for a range of cognitive disorders characterized by the decline in their memory, their reasoning, and even their thinking skills. The following diagnoses that I'm going to mention fall under the umbrella. You see my little umbrellas there? They fall under the umbrella of dementia. Alzheimer's disease is a type of dementia, but it has its own category. So it falls up under this umbrella. Other conditions that you've heard that you didn't know was under dementia. Alzheimer's disease is the most common form that you will hear with memory loss, confusion, change in behavior. Vascular dementia is another one. People who've had a reduced blood flow to the brain, oftentimes we hear about strokes, or people who have vascular issues. That's a dementia that impacts their thought process. Another one is Parkinson's disease. Who knew? I didn't. Parkinson's disease falls under a dementia. It's in the same category with Alzheimer's because eventually it impacts a person's ability, their memory, their cognitive, and their function. Another one is Huntington's disease. This is a genetic disorder that causes dementia that impacts people's movement, and their psychiatric symptoms will appear with confusion. So, to go back where I'm saying, Alzheimer's disease is a form of dementia and not the other way around. It falls under the umbrella. And if I use an analogy, and forgive me if I use cars, because I've always had Fords, I'm a Ford lady. But when you think about a car, Ford has many different cars, right? They have Escape, they got a Taurus, they got an Explorer. Everybody's had an Explorer at some point. Okay, all of these cars, if somebody say what kind of car you have, more than likely you say I have a Ford. You may not go into breaking down that I have a Taurus or I'm driving, Explorer or Expedition or whatever. So think about it now. When you hear Alzheimer's disease, just know it falls under the category of dementia. You see here, it accounts for 60 to 80% of the causes of dementia. So it is widespread in the community. It's the sixth leading cause of death in the United States. And look at that, the fifth leading cause of death in African Americans. What are the risk factors? So our risk factors are things that can impact you. I said modifiable and non-modifiable earlier. Remember, genetics. The role of family history and genetics predispose you. If you have a parent, a sibling, a child that has Alzheimer's, and I said child because it could be an older adult that end up with Alzheimer's. It's a genetic factor to it. Remember, I said Mary's mother had Alzheimer's as well. It does not mean you're going to end up with Alzheimer's because your parent had it. We're talking about risk factors. This is just a risk factor that you can't change. Health conditions. Earlier, I mentioned high blood pressure, diabetes, and heart disease increase your risk factors. Guess what? High blood pressure, diabetes, and heart disease increase your risk factors for cancer as well. So this is something we can change. I want to say you're taking care of your loved one with Alzheimer's. You want to keep this in control and manage. Caregivers that are on this call, you got to take care of yourself too, because some of you have these conditions and you're taking care of your loved one and you forget all about yourself. And now you have issues. It puts you at risk. Lifestyle factors, diet, and really, I hate saying diet, but try to eat healthier, a healthier lifestyle. Because when you put that word diet, now it's a negative connotation to it. Every time somebody says diet or dietary, right? Physical activity. I say get moving. Whatever you can do to get moving. I started walking over a year and a half ago, a couple of miles every morning. Believe me, I do sit down in between, but I'm moving more. If you get moving more, it helps with your thought processes because you're increasing those serotonins. You're reducing your anxiety that you may have that you're going through taking care of a loved one. And then it helps with mental health issues because you can start thinking about other things instead of all your issues and problems when you get out and get moving and moving around. Environmental. Sometimes environmental are things we can change, and there are some things we can't change. Access to quality health care. If you remember the statistics, it said the Caucasian more than likely could receive often a different treatment plan or notified earlier. We think about our low income neighborhoods where people don't have access to care. There's a lot of things out there now where you can get free medical care or low cost on a sliding scale. All our federally health qualified centers can see you on a sliding scale. Education and community resources. It's important to learn about Alzheimer's and the changes that you're going to see your loved one going through. Your doctor's not going to be able to tell you everything that's going on, but you're going to be that advocate for that family member you're taking care of. Now, I will mention this and then I'll move on. Research has shown your zip code can determine your life expectancy. Now, I'm going to leave that right there and you can think about it. Is it because of where you live? There's no health providers? Is it because where you live, there's a lot of violence? Those social determinants of health impact where you live in certain zip codes. Now, let's get into the different stages and phases of Alzheimer's. Remember, I said there's 7, but we're only going to talk about 3 this afternoon due to my time. So, early or mild stage of Alzheimer, memory loss, particularly forgetting recently learned information. They may repeat themselves regular over and over, asking the same question several times a day. You also have difficulty planning or solving problems. struggle with managing finances. You notice mom no longer can balance her checkbook or do the work that she's been doing before. Maybe she can't even cook and follow the recipes because she's having some cognitive issues that's impacting her. Also, confusion with time or place, losing track of dates, seasons, and time. The other one is difficulty completing familiar tasks. When you see someone having a hard time doing what they normally do, that is also a sign, a potential sign of early or mild stage of Alzheimer's. And last, change in mood or personality. Someone becomes depressed or they're withdrawing. They no longer want to go and do the things that you all have been doing together. Now, if I had to take a poll, but I'm not, all of you would say, think I've had some of these symptoms myself. Well, just know these are early stages, and there could be other health conditions that can impact you to have these same symptoms. But this is why it's important as a caregiver to write down the changes you see with your loved one. So when you go to the doctor or a health professional, we need to just say health professional because we're seeing more nurse practitioners now than we are seeing doctors directly. You need to carry this information to the health professional and let them know mom's not doing what she used to. There's been a change in her behavior. Now, I hope this picture, because I know there are non-medical people on here, doesn't bother anyone to look at it. You know, us health professionals, we get into things like this. But when you look at the brain, and I'm going to talk about the stages. We just talked about mild, right? When you look at the brain on the left, and you can see the bottom of it, that's the cut section of the brain, what it looks like. And then when you get over to the middle, we'll talk about that. That is going to be where you're going to get more to the middle or the moderate stage of Alzheimer's. And then when you get to the end, it's a late stage. So when you look at this, it may mean nothing to a non-medical person, but if you think about the behaviors are changing with each stage and phase, they're changing because you see nothing can connect when they finally get into the final stages. You know, when you look at this section of the brain, and I'll show you another picture later, the middle or moderate stage, that's the second stage we're talking about. You see increased confusion, they become disoriented, they may be delusional, have problems with speaking or language. You see, it says aphasia. We think of aphasia with strokes. When people have strokes, they know what they want to say, but it just doesn't come out. They know in their brain what it is they're trying to say to you, but they can't say it. This can happen in Alzheimer's as well. Change in the mood. They may become aggressive. Remember, Mary, I talked about at the beginning. She went through the confusion. She went through issues with speaking and she became aggressive. So just know that's not your loved one. It's the disease. It is disease that is impacting them. Now, the last stage is severe Alzheimer's, right? So when you look at this, again, look at the healthy brain on the left, and now look at this on the right. The cells are dying, the brain is shrinking, things are not connecting. And we already said they have difficulty in changing position, moving around, they aren't able to walk, and they gradually lose the ability to talk, and they may be bedridden. These signs and symptoms that I went through with all three stages and phases, someone may go through all of this, someone may go through a few. And some of you have looked at this and probably said, you know what? I know someone that have these symptoms, but they don't have Alzheimer's. You're correct. The signs and symptoms are very similar to other conditions and diseases. Even things like, um, sorry, even things like vitamins. You don't think about it. If your vitamin level, maybe D, drops, you get confused. Some people have urinary tract infections. They get confused. So you see how it's so important that the signs and symptoms are documented. So when you go to your provider, you can share, this is what I see is different in my loved one. These are things that they would have never did before. Now, there is no single test to diagnose Alzheimer's, but there are some tests that the doctor will look for. You see here cognitive tests. First thing when you go to your doctor, if you're over the age of 50 and you say you're having confusion, they'll do a minor memory test, but it needs to be more in depth than that memory test because all of us probably can pass it. Believe it or not, I could probably pass the test, but I have been having cognitive issues, right? So, neurological exams, brain imaging, when we talk about that, the doctor may order a CT scan, they may order an MRI of the brain or a PET scan. And remember how we saw the brain changing? These are the changes that the doctor would be looking for on those scans. And, the radiologist will lay it all out for the doctor and let them know there are changes that are going on. Now, they may order a lumbar puncture. With the lumbar puncture, they're looking for a protein. And I just recently learned about this protein, but there's a protein called beta amyloid and a Thai protein. So when they do the lumbar puncture or they do lab work, they're looking for these proteins to show up in that spinal fluid or in the labs. These are markers that you'll probably have Alzheimer's disease. It's not totally definitive, but again, it's a protein that you will see if someone has the beginning of Alzheimer's. The importance of an early diagnosis is so that the doctor can treat the symptoms. And I keep saying doctor, and I just want to say health provider, that they can treat the symptoms, signs and symptoms. Because remember what I said, the different stages and phases. Somebody may just need some medication to help them remain calm while they're at home. Somebody may need medication to just help them be able to rest at night. You have family members up that are walking all day and all night that have Alzheimer's. They may be walking and talking, and it's nothing you can do. So when we talk about the treatment options, and again, I'm not going to go into all of them because that's not my arena, but you see this non-pharmacological treatment, cognitive therapy. When you started noticing that your loved one's losing things or whatever, they may be able to go through cognitive therapy to help them to adjust. It's very frightening to have a condition and you're losing it. You heard what I said about my friend. She knew she was losing it, and we talked about it. And so it's very frightening that your lifestyle is changing. Lifestyle modifications. You may also need to consult with a neurologist, definitely. You'll be referred to one, but you may need mental health counseling to help you and your family go through this. Clinical trials, I definitely believe in clinical trials. If this is genetic, then we need to be looking at it. We need to be participating in clinical trials. And there are many groups here in town that does that you can look into. I recently went through and checked, and I found out I don't have the protein. And no, I don't have Alzheimer's, but it doesn't mean I'm not going to get Alzheimer's, okay? But at least I'm looking into it. So consider clinical trials if you see it's something that run in your family. Work with your provider. You're the advocate. Work with your provider on what's going on and have an established primary care. Now I'm going to shift real quickly because my time is moving on, but I think it's been well spent to talk about Alzheimer's dementia, learn about what is the differences between the different stages and phases of Alzheimer's. Now I'm coming to a point where I want to talk about the Alzheimer's caregiver, the issues. When you look at the picture at the top, it may feel like you. That's a nurse bending over. You're taking care of your loved one day in and day out. That caregiver is the one that's there in the house. And thank you to those that do stop by and drop in and help out, because everyone have life issues and situations that you can't be there, but you begin to feel like the nurse because you're changing them, you're bathing them, you're feeding them, you're setting out their medications. So you begin to feel like, hey, I'm a nurse. I'm a nurse's aide because I'm doing all these things. Do you know they say 18 billion hours of unpaid care annually is done by a caregiver? Okay, that is you if you're a caregiver. When you look at that bottom picture on the right hand side, caregivers, You think about the love, all the love that you give to your family member. You're thinking about the memories. We said we always want to keep the memories. Let's keep the good memories. Let's stay positive as much as we can. But you're going through a lot of trials, right? But you're loving on your family member. And the left side, that picture is a support group. If you have the opportunity, join a support group. A lot of things are virtual right now. And at the end, I'll just give some resources where you can do that. I'm sorry if I have an alarm going off. I can't get to it to turn it off. Um, but Alzheimer's caregivers, what I want to say to you, I want to just stop and pause. And this is for all the caregivers, not just for Alzheimer's, but any caregiver. And I found this and I said, I just want to read it. I want you to take a moment to acknowledge the incredible work that you do on a daily basis. Your role is not just a job, it becomes a calling. Not the same calling as a pastor, but it's a calling that you have been assigned to take care of your loved one. It takes a special kind of person to have the strength and patience to care for someone that's going through Alzheimer's. You may not always see the impact of you being there on a daily basis, but I say thank you. If no one else has said it, I say thank you for what you're doing to take care of your loved one. Just know that the dedication, the time, and the energy you're putting out is profound. You are making a difference in your loved one's life. We can't change chronic conditions that go on and become, where it's nothing you can do. I want you to remember you're not on this journey alone. Even in the toughest moments that you have, when the days feel long and the challenges seem overwhelming, I want you to know you are supported by a community that understands and by God who sees and honors your commitment. And last, I want to say, take care of yourself and never forget that your well being is just as important as the person that you're caring for. You're the unsung hero, and your compassion and perseverance are deeply valued. Stay encouraged and know that your efforts are making a lasting impact, even when it's hard to see. That is the work of a caregiver. I just wanted to pause and say that because oftentimes you feel like what you're doing doesn't matter. Nobody sees that you're up all night or all day taking care of your loved one, keeping them safe. We do acknowledge you and we appreciate you for that. Now I'm going to move on to the Alzheimer's care team. Remember, I said it's a family affair. On the left, we see who's the caregiver in that picture. Any one of them, any one of you that I'm looking at right now may be the caregiver. You're making the medical decisions. You're lining up everything from their clothes to their foods. So think about next, who is a part of this care team? Health providers, health agencies, home health agencies, social workers, case managers, community health workers, and I'll briefly will mention hospice. I'll mention it even further later. And then next, we see family, friends, neighbors, co-workers, your church members. On the very end, it says church, deaconess, deacons, usher ministry, health and wellness ministry, any part of your church team and family should be reaching out to these family members. They're not at church for a reason. They're not at church because they're taking care of loved ones. I know now we have Zoom and everybody can do Zoom and they're not there. But when people are missing that you know they have a loved one that's suffering from Alzheimer's, check in on them. See, is it anything you can do? Can you carry a meal to them? Can you help them carry their loved one to the doctor? Maybe, maybe not. And as I come to a close, pretty much to a close, I do want to mention never say never. What do you mean, Connie? Never say never. Never say never. Never tell your loved one that you won't place them in a nursing home. Please promise me. Because what I find is people tell their loved one that, their mother, their father, I'll never put you in a nursing home or skilled nursing facility. But guess what? When that brain has totally shrunk and everything is disconnect, it's not the same person you were taking care of. And when it becomes 24/7, you are now unable to do it anymore. So that's where you need help. You know, God provides us all we need. And we hear he never puts more on us than we can bear, but he gives us the gift and the resources that we can reach out and get help when we need that. Caregiving challenge, again, I say to you, continue caregivers to take care of yourself. There are all kind of support systems that I just showed you. And I put here culture consideration. Okay, what does that mean? There are various cultures who have already said, I will honor my father and mother. Okay. So your days will be long. I'm not going to let them down. But if it becomes too much, it's not letting them down. In their best interest, you're helping them. Have these conversations when family get together. Who's the decision maker? Because when I work in the hospital, I'd have to go and the families there fighting over who's making decisions for the loved one. Make the decision when your loved one is in their right mind. Please, please do that. Who is the decision maker? Who's going to tell us what we need to do next? Physician appointments, I'll briefly scan and say, again, write down the changes when you go to the doctor. Because once you get to that doctor and the doctor's talking and they're moving through real quick, you done forgot already that mama lost her keys or her glasses or she put stuff in the refrigerator that shouldn't have been there. Write it down so when you go to your provider, you can share it. Because remember, the signs and symptoms can be very vague. They can be similar to other things. And last, self-care, I already told you, you have to take care of yourself before you can take care of someone else. Keep in mind, the one thing about on an airplane, what do they say? When that oxygen mask fall down, you're going to put it on yourself first before you put it on your child or someone else. Same thing here, caregivers. I need you to put that oxygen mask on and take care of yourself first. The last few things that I have are resources. Again, Alzheimer's Association, the National Institute of Health may have caregiving information. I want to go back. Alzheimer's Association have a 24/7 helpline. You know, at night when it's late and you don't want to call a friend or family, they have a line you can call and get some assistance. Local support groups. If you're still working, EAP, Employee Assistance Program, your job have that available for you, and it doesn't matter. Because you know what? When you go on that family medical leave, you're losing finances and funds. You yourself are going to need help. The government programs, our veterans, they got caregiving programs for you. Faith-based, we already talked about churches, what you're going to do to help people that have Alzheimer's in their family. And depend on where you are, contact 211 because 211 in the state of Florida, you can get just about any resource that's out there. And as I come to a close, and I know I try to move around swiftly with this topic, I want to say this, and I'm going to do a little prayer before I leave. And I know she'll close out with a prayer, but I found this and, you know, I thought it was fitting that I go over it. I hope the information I gave you a better awareness of what Alzheimer's disease is versus dementia. It falls under the umbrella of dementia, but it's its own standalone condition. I hope you remember the stages, the early stages, minor things, forgetfulness, the middle stage or the moderate stage, the late stage where they're now unable to do things for themselves. Caregivers, you have to take care of yourself before you can take care of someone else. I hope I gave you some tips and suggestions on this topic. It's very dear to me because of my dear friend Mary. I thank you for your time. I also found out before I came on this call that I didn't even know I had Alzheimer's in my family. I just got told by a cousin that my uncle had Alzheimer's. I never knew that. So it's important when you're with your family, talk about these diagnoses and conditions because we said this is genetic. I'm going to ask for you to now all close your eyes, open your heart, and open your mind to what I'm going to do this prayer for Alzheimer's caregivers. Dear Heavenly Father, we come before you with heavy hearts, lifting up all those who care for loved ones with Alzheimer's disease. Grant them the strength and patience they need to face each day and the wisdom to navigate the challenges that come their way. Fill their hearts with love and compassion, even in moments of frustration or fatigue. May they find comfort in your presence, knowing that they are never alone in this journey. Lord, give them the endurance to care for their loved ones with grace and dignity. Help them to remember the precious moments of joy and connection and to cherish all the loving memories that they may still remain positive. When the burden feels too great, remind them to turn to you, Father, for comfort and rest. We pray for peace in their hearts and minds and that they feel your loving arms that's wrapped around them, providing the support they need. Bless them with the help and resources they require, and let them know their work is sacred and deeply appreciated. In the mighty name of Jesus, we all say amen. And I thank you, Dr. Sankey, and your organization for inviting me to speak on this much needed topic. Thank you.
Thank you very much, Connie. This topic was a topic that we all need to hear because we never know when we will need the information. You know, I experienced taking care of my mother who had dementia. And I think it was due to, it was a vascular, more vascular. She had a history of high blood pressure and he had, was having strokes. So therefore she ended up with dementia. And it was very difficult. Although I had my brother who helped and my father was there as support, and I also had respite care. Respite care was also very helpful in aiding me assistance or when I need relief to be there so I can take her to a center or place so I can go away for a weekend or something like that. So I really appreciate you coming here and sharing. Oh, I'm sorry, something happened. Come here and sharing, Alzheimer's. I have learned, distinguishing the difference between Alzheimer and dementia. I fully understand that a whole lot better now. And for sharing, the different risk factors and resources that's out there for us to benefit from. So I will open up the floor for any questions. Anyone have questions for Connie? You can go ahead and ask your questions.
I do want to mention one thing that like you said, respite care that I left out. Palliative care and hospice, because for some reason people don't like to say the word hospice, but palliative care and hospice are options. Whether you're signed up with them or not, they can provide you with respite care. They have hospice houses that you may need to get out for a weekend because there's nobody else to help. So when your loved one get in various stages, talk with your health provider if that's an option. Hospice, I'm a believer in hospice. I used it for my mother, my father, and a 9-year-old son. So I'm a believer in hospice that they can provide other services. Maybe you've been bathing your loved one, for 2-3 months. They can come in and assist with, taking care of your loved one. When I say that, they're not going to be there daily, but they can provide resources like social workers when you need help with finances, because you're going to need some help with finances at some point. They can also provide help when it gets down to where you're in those last stages, that if you don't want your loved one in a house, they can carry them to the hospice house and you can sit there with your loved one. And I share this because, as I mentioned, I had hospice with my son, 9-year-old, not for Alzheimer's, but for cancer, but it's still caregiving. But they were able to assist us with everything. So I want people to look into the benefit. That's what it is. It's a benefit of hospice because you may need it in the later stages of, of life. I forgot to mention that, but I did want to put that in there. So thank you for reminding me about respite.
Yeah, that's true. You're welcome. Because I know when people hear the word hospice, they're just like, oh my goodness, my family member, they're gonna die. That's the end of it. But there have been people who were on hospice and got off of hospice Hospice does not mean that you're going to die immediately. It's an excellent support extension of Medicaid. I think it is Medicaid. It's an excellent support group that that will be very, very beneficial for those of us as caregivers who need that help. So don't be afraid to reach out there and get assistance. Talk to your physician, have them assess your family member, and refer them to hospice. And as I said, it's not something that, you know, it's not bad in the sense you are not trying to hasten the death of your family member. It's not that. It's a very good support system that can help you go through this, help you with the care of your loved one. Anyone have questions for Connie? Connie, early diagnosis is important, as you mentioned. So with the early diagnosis, what are some of the treatments or care that someone can have? Is it going to slow down the dementia or the Alzheimer's disease, or is just going to keep the person calm?
Everything that I found in research, it's not necessarily going to slow it down. And remember, I talked about the different stages. So it depends on what type it is and what's going on, with the treatment. They're treating the symptoms more so because the medicine can't stop it from happening. As you saw, the brain is shrinking. The medicine can't stop it. The medicine is to treat the symptomatic issues that are going on with the individual.
Okay, thank you. Yeah. So basically, there's nothing, once you're diagnosed with the Alzheimer's, there's nothing you can do but just let it, the courses, let it go through its different stages.
That's what I found. But remember, it's maintaining. If you think about your health conditions, hypertension, diabetes, you have it, once you're diagnosed with it, you have it for life. And the best thing they do is manage your symptoms. So that's what you're doing with Alzheimer's. You're managing the symptoms, because if someone get aggressive, they can give medication to kind of calm them down, to keep them calm, as I mentioned earlier. But the medicine is not going to slow down. You can look into clinical trials, because there may be clinical trials that are out there that can help impact it. But once you're diagnosed, you have the diagnosis. But again, I know we don't like to talk about the end of life or death, but if you're born of a man, you will eventually die from something on this earth. And the thing we try to do is have a good death. We had a good birth, we had a good life, we want a good death. And if we put things in place that can make it comfortable for people, as I mentioned, I knew someone that their family member walked all night long. And during the day, they had their days and nights mixed up. The doctor can give them something to, help them relax, to calm them down. So it's more of symptomatic, what is going on with them. But you can't stop the brain from what it's doing when it's shrinking. The cells, are drying up more or less and disappearing.
Yeah, I'm sorry to hear about your friend, Miss Jackson. So it seemed like her dementia was very rapid, because I know of people who have had dementia for years, and the decline is very slow. So I guess it differs from person to person.
Well, they first thought symptoms that she was having, because if you remember me talking about symptoms, her forgetting things, losing things,
Right.
by the time she had got to digression, keep in mind, 10 years prior, you already have symptoms that someone hadn't identified. And it's ladies on this call. Ladies, we know when we go through menopause, we get forgetful, we lose things, and there are other conditions that make you forget things. So hers didn't progress as rapidly because she was diagnosed in her 50s and she died in her 60s. So there was a 10-year span where this all of this went on. It wasn't just like overnight, but
Okay,
it's unusual when you start seeing in 40 and 50-year-olds, but they do. So she had symptoms that hadn't been identified, earlier. Yeah.
okay,
Mm-hmm.
okay. Mm.
No
Okay,
questions,
any
anyone?
questions? Let me see if anybody put anything in the chat. Nothing in the chat. Okay,
So I must have covered everything that or either you knew all the information. I like that where she says, good information, key fact to choose healthcare surrogate to make decisions. You're exactly right. When you're having those cookout and those family Sunday meetings, you need to be talking about who is going to make decision for the loved one. And if the loved one can make decision when they're in their right mind for any condition, it's
Yeah.
better, because oftentimes when you're down in the hospital and they want you to make them a DNR, you can't do it. It's hard to make someone a do not resuscitate. But if you've already had these conversations with family members, you can work with the elderly attorney on information, because you need to know where they keep things, because guess what? If you're not paying on the house that they're in, and you're just thinking letting everything go along, somebody has to take control of that family member and help out, because they can end up losing a house, not making house payments, not paying the insurance, the taxes, and all of that. But there needs to be a gatekeeper. And I find a lot of times it would defer in the hospital to the oldest child. And the oldest child might be the one who never comes around to see anyone. But thank you for saying that about healthcare surrogate. You need to have your papers in order, all your papers in order. And I'm not saying to just look at total end of life, because we talked about the joy and the memories that we have with our loved ones. So, document. If you journal the funny things, because they're going to say some funny things to you, and it's really not funny in the sense of laughing, but they do say some things that are totally out of character that'll kind of catch you off guard, and you be laughing with them. There's joy in our life, and there's joy on our journey in life, and there's joy when we take care of our loved ones. There's sadness, but there's joy as well. So keep your memory of the joy and the smiles and the fun that you have with your loved ones.
yeah, that is so true. I remember clearly things that my mother would say to me that I know she, were just totally out of character, and we can laugh about it. At the end of all that, I felt so contented. I felt that I did my best, my all that I could have done for my mother. And at the time of her death, I had no regrets. So it's so very important for us to be there for our loved ones. And you might not have to do all the caring, but just to be there, to sit and talk with them or whatever it might be, it's something that you do not want to miss out. But if you can, be there as much as you can for them.
I see a question about cholesterol, and you know what? Thank you. Cholesterol was another one. So usually when you see high blood pressure, a lot of times people also have cholesterol issues. So cholesterol thank you, is a risk factor as well. So, when we're talking, those of us that are health professionals on here, when we're talking with our family members about their medication, you do want to make sure their cholesterol is in check, because you heard me say vascular dementia. People have strokes a lot of time, have high cholesterol, and what happens? Something can break off, go to the brain, right? You have a stroke. And I find that people don't control their cholesterol. They don't want to take the cholesterol med, but there are different types of medications out there now that you can take. They never could control mine because it's hereditary in my family, but they finally found an injection that I just take an injection every other week. I am my lowest in 20 years, which will help impact, like you said, brain health. So thank you for bringing that up. That is one. Cholesterol, diabetes, high blood pressure, cholesterol are all risk factors that you see.
Well, I think I'm sorry, they call Alzheimer's diabetes, but third type of diabetes. I think something with diabetes as a Alzheimer's is type 3 diabetes. I've heard them mention it in that realm. So I think also the question is asking if you have too low of a cholesterol, can that affect the brain and that cause dementia?
I won't say, I'm not as familiar with that.
Mhm.
But if that's something you have looked up and seen, I'm not sure about the low cholesterol. But I did find, as she mentioned, the high cholesterol, because we talked about the vascular issues. And we know when you're dealing with vascular issues, a lot of times people have high blood pressure and that combination cholesterol, and maybe even diabetes. You don't have to have all of them.
Yeah. Yeah. So if you have good, healthy cholesterol, that's so very important. Good, healthy cholesterol is important because the brain needs cholesterol to function. And we need cholesterol so it can help to maintain healthy hormonal levels. So cholesterol is healthy. So I think the answering that person's question, low cholesterol you need for the bad, the LDL, the lipid density protein, lower lipid, yeah. But the high lipid density protein, the HDL, yes, you need lots of those good healthy cholesterol to help keep brain health, heart health, and all vascular diseases away.
So Connie, this is Jennifer. Just want to
Oh.
say thank you so much for sharing such valuable information today. Sometimes we kind of skirt around topics when it comes to memory and memory loss and changes in behaviors for family members or even church members or friends. But you've made it pretty clear of some of the signs and symptoms that we need to look for. And then how can we provide that support for them, without even diminishing who they are as an individual? Because sometimes individuals who have lost that memory, like your friend, a nurse, someone who was used to being in control of everything, then sometimes their worth, they may feel low self-worth because they don't feel like they can function anymore, and that we don't want to baby them, but we want to support them. So thank you so much for sharing that information today.
Thank you for inviting me, both of you, for inviting me to this Living Well series. I thank everyone who took the time to come on. It left you with something that you could take, if it was nothing other than the clarification of dementia and Alzheimer's.
All right.
I have one other question.
Go right
I'm
ahead.
sorry. I have another question. The you mentioned some additional cholesterol that you took or that you're taking, and some of them are more effective than others.
Oh,
It
Ciela, we
chopped you.
cannot hear you.
It chopped you totally up.
Oh. Okay, I'm sorry. My phone is acting up. Just one of the medications. Can you hear me now?
Yes, we
Yes.
can hear you clearly.
One of the good cholesterol medications. Can you name one of them?
I would really like to say, I know there was a waiver at the beginning. I would kind of like to leave it with the waiver, because everybody's situation is different, and you really need to work with your health provider. And you can ask your pharmacist. The people that know the medications best is the pharmacist. What are other meds out there? Because the medicine I'm on is very expensive, but a foundation was found to pay for it because Medicare would not pay for it. So there are also clinical trials, as I mentioned earlier, where you can get medications for free. But I'm going to defer any medical medications to your provider, because everybody's situation is different.
Yes. Thank you. Thank you.
Thank you.
Okay. Okay, any other questions? Okay, again, Connie, thanks for coming on and sharing your knowledge about Alzheimer's with us. We really appreciate it. This is a topic that is really needed, and we have all learned. I have learned from it, and I know our audience also have learned something from what you presented here today. So thank you again. And I hope this is not going to be your last time coming on. We are always on every Saturday at 4:30. If there's any other topics that you think you want to share with us, we welcome you to come join us and share your knowledge. Thanks
Thank
again.
you.
At this time, we're going to stop recording.